Anthony Albanese has described this $8.5 billion Medicare boost as the beating heart of Labor's re-election pitch. What this money will go towards is essentially boosting and expanding the financial incentives for GPs to bulk bill their patients. Currently, these incentives only apply to pensioners, concession card holders and children under the age of 16. So this will be expanded to cover every Australian with a Medicare card in a measure that the government says will see an uptick of 18 million bulk billed appointments each year. As we know, bulk billing rates have been on the decline. It has been a problem for successive governments. So Labor certainly hopes that this will help Australians with cost of living pressures and stop them having to reach into their pockets to cover these medical costs. When it comes to some of the reaction this morning, the Australian Medical Association, the Royal College of General Practitioners, they have largely welcomed this measure. They say it is a necessary and urgent boost to a sector that has been under enormous pressure, especially since the COVID pandemic. They have warned, though, that ultimately not every GP is going to pick up these measures or take on these incentives just because overhead costs are so high, especially if you're a GP operating in a city or perhaps metropolitan areas where rents, insurance and wage costs are so high. The Prime Minister today, though, saying that this funding boost is an important one, and he's framing this as an expansion of Labor's legacy on Medicare. Have a listen.
This election is a make or break moment for Medicare. A re-elected Labor government will make it easier for Australians to see a doctor for free. We will make Medicare stronger than it has ever been.
And Olivia, the Coalition has also made an announcement on Medicare.
Yeah, they certainly have. So ultimately, this policy is due to be welcomed, you'd say, or you'd expect to, by financially strapped families, young Australians, many of whom have been putting off visits to the doctors just because those out-of-pocket costs are so high. So it is expected to be a hit in marginal seats, especially in outer suburban areas, which the Coalition is trying to pick up. As we heard from the Prime Minister's commentary earlier, he was arguing that Medicare is under threat, or would be under a coalition government. But we've seen an announcement from the opposition leader Peter Dutton in just the half hour where he has essentially said not only will he match this Medicare funding, he will increase it, offering $9 billion over the next 4 years. We did hear from the Shadow Treasurer Angus Taylor this morning. He essentially says that this funding increase is essential and necessary because Labor has actually seen, or over the course of this government, we've seen a decline in the bulk billing rate more generally. Have a listen.
We're not going to get in the way of Labor cleaning up the mess that it has made. And it's important that that mess be cleaned up. What should have happened is we should have kept the gains or the benefits that we'd had when we were in government, that higher level of bulk billing, that lower level of out-of-pockets. But Labor's failed again. I mean, in sector after sector after sector, we see their failures.
So we're starting to hear there some of the political attack lines that we can expect to hear both from Labor and the Coalition once the federal election campaign is called in earnest. I would also say that the rally today in Launceston in Tasmania, that choice or location is no accident. It's a seat that is ultra-marginal. It's currently held by Liberal MP Bridget Archer. And federal Labor does hope that policies such as these aimed at Middle Australia with a real cost of living flavour help them to either win votes or win seats, especially in outer suburban and regional areas.